Welcome. Today we're diving into a comprehensive comparison between teaching principles and medical technology, MT principles, especially as they relate to future medical laboratory science MLS educators in the Philippines. While these two sets of principles operate in different domains, one focused on how we teach, the other on what professionals must do in laboratory practice, they are deeply complementary. Understanding both is essential for anyone preparing to educate the next generation of medical technologists. Let's begin by exploring the core ideas behind each set of principles and why their synergy is so crucial for effective MLS education. Teaching principles are the foundation of effective education. They guide how instructors engage students, foster ownership, and create an environment where learning thrives. In the context of MLS education, these principles emphasize student-centered engagement, intellectual self-esteem, and the development of independent, critical thinkers. The goal is to make learning meaningful, interactive, and relevant, setting the stage for students to become confident professionals. Let's look at the core guiding principles that shape this approach. One of the most important teaching principles is sharing intellectual control with students. This means involving them in decision-making, whether it's about content, activities, or assessment methods. When students have a say in their learning journey, they feel more invested and motivated. This principle encourages educators to create opportunities for choice and independent decision-making, which not only boosts motivation, but also prepares students for real-world problem-solving. It's about building a classroom culture where everyone's voice matters. Allowing students to work out content or instructions on their own is another key principle. This approach promotes self-discovery, which leads to deeper understanding and better retention of knowledge. Instead of simply providing answers, educators guide students to explore, question, and find solutions themselves. This process not only enhances learning outcomes but also builds confidence and independence, qualities essential for future medical technologists. Providing genuine options in content, difficulty, format, or timing is vital for student motivation. When learners can make choices, they feel a sense of ownership and responsibility for their progress. This principle encourages educators to design activities that cater to different interests and learning styles, making the classroom more inclusive and dynamic. Ultimately, this leads to higher engagement and better learning outcomes. Diversifying ways for students to experience success is crucial, especially for those who may struggle academically. By using a variety of activities, such as discussions, role plays, and creative tasks, educators can help all students find their strengths and build intellectual self-esteem. This approach ensures that every learner has the opportunity to shine, fostering a positive and supportive classroom environment. Encouraging exploratory, tentative, and hypothetical talk is another hallmark of effective teaching. By fostering an environment where students can ask, what if questions and engage in predict, observe, explain activities, educators stimulate curiosity and critical thinking. Delayed judgment and increased wait time allow students to process information deeply and develop their reasoning skills, which are essential for scientific inquiry. Learning from peers, questions, and comments shifts the classroom dynamic from teacher-centered to student-student interaction. This principle values the insights and experiences that each student brings, promoting a collaborative learning environment. Peer learning not only enhances understanding, but also builds communication and teamwork skills, qualities that are vital in the medical laboratory setting. Building a risk-taking environment is about creating trust and encouraging respectful disagreement. When students feel safe to take intellectual risks, they are more likely to engage deeply with challenging material and learn from their mistakes. This principle helps prepare future MLS professionals to handle uncertainty and complexity in real laboratory situations, where critical thinking and adaptability are essential. Using a variety of intellectually challenging teaching procedures keeps students engaged and combats passivity. Rotating methods such as group work, case studies, and simulations ensures that learning remains dynamic and relevant. This approach not only maintains student interest but also helps them develop a broad range of skills needed for professional practice. Promoting procedures that target quality learning aspects addresses specific issues, such as the lack of real-life connection in classroom tasks. By designing activities that link theory to practice, educators help students see the relevance of what they're learning. This principle ensures that learning is not just theoretical but also applicable to real-world situations, especially in the context of medical laboratory science. Developing awareness of the big picture helps students understand how individual tasks connect to overarching ideas. This principle encourages educators to highlight the broader significance of classroom activities, fostering a sense of purpose and direction. For future MLS professionals, seeing the connection between daily tasks and community health outcomes is especially important. Raising awareness of quality learning aspects involves using debriefings and shared vocabulary. By reflecting on what was learned and how it was learned, students develop a deeper understanding of the learning process. This principle supports continuous improvement and helps students become more self-aware and intentional in their studies. Integrating assessment as part of learning means using formative, student-owned assessments with transparent rubrics. This approach shifts the focus from grading to growth, allowing students to track their progress and take responsibility for their learning. It also ensures fairness and clarity in evaluation, which is essential for building trust and motivation. Beyond guiding principles, practical teaching applications are essential. These include keeping students engaged by posing questions, limiting lectures to 20 minutes with active breaks, and fostering active learning through skill development and value exploration. Writing activities, effective use of technology, clear grading systems, and open communication channels all contribute to a supportive and effective learning environment. Teaching in laboratory or studio settings requires special attention to objectives, safety, and the connection between theory and practice. Educators circulate among students, provide guidance, and emphasize the importance of safety protocols. This hands-on approach mirrors real clinical environments and prepares students for the demands of professional laboratory work. Technology should be used as a means to enhance learning, not as an end in itself. Effective integration of digital tools can make lessons more interactive, accessible, and engaging. However, it's important to ensure that technology serves the learning objectives and supports student development, rather than becoming a distraction. Announcing grading systems early, using rubrics, and providing ongoing feedback are essential for transparency and student growth. Clear communication about expectations helps students understand how they will be evaluated and what they need to improve. Regular feedback supports continuous learning and helps students stay on track. Effective communication is the backbone of successful teaching. Providing clear syllabi, multiple channels for consultation, and regular updates ensures that students feel supported and informed. Open communication fosters trust and helps address any issues that may arise during the learning process. Now let's shift our focus to the principles governing medical technology practice, as outlined in the 2022 Code of Ethics. These principles set the ethical and technical standards for laboratory professionals, emphasizing patient safety, accuracy, and professional accountability. They are structured around responsibilities to patients, self and the profession, colleagues, and the health products industry, along with a 13-point professional pledge. Primary duty of medical technologists is to provide faithful, conscientious, timely, and caring service to patients without discrimination. This includes maintaining strict confidentiality of patient information, performing only lawful procedures, and always prioritizing patient safety and best interests. Seeking assistance when tasks exceed one's knowledge or skills is also a key aspect of professional responsibility. Medical technologists must personify professionalism, integrity, responsibility, and competence. Continuous professional development (CPD) is mandatory, ensuring that practitioners stay updated with the latest knowledge and skills. Compliance with laws, quality assurance, good laboratory practice, biosafety, and biosecurity are non-negotiable. Reporting illegal acts and engaging in community service are also part of the professional commitment. Establishing cooperative, honest, and respectful relationships with colleagues and other professionals is essential. Medical technologists must act with fairness, maintain fellowship, and respect the scopes of practice of allied professions. These collaborative relationships are crucial for effective healthcare delivery and patient outcomes. Medical technologists must collaborate ethically with the health products industry, HPI, to advance technology and improve healthcare quality. Interactions should be based on truthful, evidence-based information while preserving independent decision-making. This ensures that professional integrity is maintained and patient welfare remains the top priority. 13-point professional pledge summarizes the core values of medical technologists: accepting responsibilities, upholding dignity, reliability, honesty, and integrity, performing with confidence and accuracy, maintaining confidentiality, continuously improving skills, sharing knowledge, contributing to professional organizations, practicing fairness, avoiding conflicts of interest, dedicating lab science to promoting life, upholding the law, and reporting violation. These commitments ensure that practitioners remain ethical and accountable. Teaching principles are oriented toward the educational process, how to teach effectively and engage students. In contrast, medical technology principles focus on professional practice, what to do in the laboratory to ensure patient safety and accurate results. While their domains differ, both are essential for preparing competent and ethical MLS professionals. Primary focus of teaching principles is student engagement, motivation, and intellectual self-esteem. For medical technology principles, the focus shifts to patient welfare, safety, and the delivery of reliable, ethical laboratory services. This distinction highlights the complementary roles of educators and practitioners in the healthcare system. Teaching principles aim to build confident, independent, critical thinkers with big-picture awareness. Medical technology principles, on the other hand, focus on delivering reliable, ethical, and life-saving laboratory services. Both sets of goals are crucial for developing professionals who are not only skilled but also principled and patient-centered. In teaching, calculated risk-taking and exploratory talk are encouraged to foster learning and innovation. In medical technology, the priority is to minimize all risks through strict accuracy, quality assurance, and biosafety protocols. This contrast reflects the different demands of the classroom and the clinical laboratory. Classroom discussions often encourage open sharing of ideas, while in the laboratory, confidentiality of patient data and results is strict and non-negotiable. This difference underscores the ethical responsibilities unique to medical technology practice. Teaching principles promote continuous improvement through reflection, debriefing, and big-picture awareness. In contrast, medical technology principles require mandatory continuing professional development, CPD, skill upgrades, and strict compliance with quality assurance and biosecurity regulations. Both approaches ensure ongoing growth and competence. In education, collaboration is fostered through peer learning and student-student interaction. In the clinical laboratory, collaboration involves interdisciplinary healthcare teams and ethical partnerships with the health products industry. Both forms of collaboration are essential for effective learning and professional practice. Assessment in teaching is formative, rubric-based, and student-owned, focusing on learning feedback and growth. In medical technology, assessment centers on quality control, proficiency testing, and self-reported competence, ensuring professional accountability and high standards of practice. Teaching principles emphasize creating a safe, trusting, and risk-taking classroom or lab simulation. Medical technology principles demand a controlled, compliant, and biosecure clinical laboratory environment. Both forms of safety are vital: psychological safety for learning and physical regulatory safety for patient care. The outcome of teaching principles is engaged, reflective future professionals. For medical technology principles, the outcome is competent, ethical MLS practitioners who improve patient outcomes. Preparation through education leads to high performance in professional practice. Sharing intellectual control in teaching translates to students co-designing laboratory protocols, fostering autonomy and responsibility. This connection helps bridge the gap between classroom learning and real-world laboratory practice, preparing students for the demands of the profession. Active learning and peer learning are brought to life through case studies on blood analysis and group diagnostics. These activities mirror real clinical environments, emphasizing safety and teamwork. By engaging in hands-on, collaborative tasks, students develop the skills and attitudes needed for effective laboratory practice. Using rubrics and formative assessment ensures fair evaluation of technical competencies. This approach not only supports student learning but also aligns with the standards of professional practice in medical technology, where accuracy and fairness are paramount. Developing big-picture awareness links classroom work to broader community health and disease prevention. By understanding how their actions impact public health, students are better prepared to contribute meaningfully to society as future MLS professionals. At Riverside College, mental health, health promotion, and playful problem-solving are integrated into laboratory protocols. This innovative approach makes tedious lab work more engaging and supports student well-being, demonstrating how teaching principles can enhance the learning experience. Silliman University uses reflective debriefs to promote risk-taking and peer learning in clinical simulations. By encouraging students to ask, "Did I achieve my goal?" educators foster a culture of reflection and continuous improvement, preparing students for real-world challenges. Teaching principles provide the vehicle for delivering medical technology principles. They equip educators with the tools to engage, empower, and inspire students, ensuring that ethical and technical standards are internalized and practiced. For future MLS educators, mastering both teaching and medical technology principles is essential. This dual expertise allows you to design curricula that embed ethical standards, model excellence, and prepare graduates for the realities of Philippine healthcare. By integrating both sets of principles, you become a bridge between academia and clinical practice. Effective integration of teaching and medical technology principles produces MLS graduates who reduce laboratory errors, strengthen healthcare teams, and uphold the dignity of the profession. As educators, your influence extends beyond the classroom, shaping the future of healthcare in the Philippines. In conclusion, teaching principles and medical technology principles are distinct in focus and methods, yet they form a powerful synergy in MLS education. Teaching principles equip educators with the strategies to engage and empower students, while MT principles provide the ethical and technical standards that guide professional practice. The ability to weave these two together transforms good instructors into transformative mentors, producing not just skilled technologists but principled, patient-centered professionals ready to serve Philippine healthcare.